Treatment is purely surgical, but we need to just investigate to rule out any medical issues. There could be maybe thyroid issues or hypothalamic pituitary axis issues or chromosomal issues. As I mentioned to you earlier, majority of the times, most of the investigations are normal. Hi everyone, this is Dr. K. Ramachandran. I'm a senior consultant in cosmetic surgery at Apollo Spectra hospitals in Chennai. Today I'm going to talk about a specific subject for men. It's called Gynecomastia, and it's a very common problem which men face, and it means enlarged male chest. So whenever the male chest is enlarged, may not be as big as a woman's breast, but certainly bigger than what a normal male should have. That condition is called gynecomastia, and it causes a lot of psychological trauma and usually happens when the children attain puberty, and then they feel very embarrassed about it and they get teased about it in school because of the enlarged chest. Most of the times their hormone profile could be normal, and that means it comes into the category of idiopathic. Otherwise, we have to check on the hormone profile, and endocrinologist usually comes into the picture and helps us to decide whether everything else is normal. But despite that, many of the children have normal profile, or some of them could have some chromosomal abnormality or even some abnormalities in hormones. But the treatment per se, even if it involves some medicines, the main treatment is still surgical. Basically, there is nothing like a symptom. It's a physical appearance which changes. That means the chest starts looking bigger. It's not muscle, it's just enlarged breast-like appearance which happens especially during puberty and persists thereafter. So it is not something that needs to be diagnosed with help of tests. It's basically a change in the physical appearance where the chest appears abnormal, and I think the patients themselves say that it is looking odd. Treatment is purely surgical, but we need to just investigate to rule out any medical issues. There could be maybe thyroid issues or hypothalamic pituitary axis issues or chromosomal issues. As I mentioned to you earlier, majority of the times, most of the investigations are normal. So that's why we call them as idiopathic, but we still do some basic tests and then proceed with surgery. I think by now children are very well aware of what gynecomastia is because of the Google search which they're able to do. So whenever they come for a consult, if they're 15 or 16 years old, they are able to tell exactly what their problem is, and they feel shy taking off their clothes in a temple or when they go to a pool or whatever. Gland is a little hard substance which does not come out by lipo, so we'll have to do an excision procedure. So it requires about 2 hours of surgical time and usually day care, and by the time it's about 10 days, they are more or less normal. It's very difficult unless it's purely obesity. Supposing somebody is grossly overweight, then he'll have fat everywhere, including the chest. That is called a pseudo-gynecomastia. But the other types of gynecomastia, many times the patients have normal weight and they just have an enlarged chest for whatever reason. And in such situations, it will be very difficult to just alter the lifestyle and correct it. Surgery is still the answer, but it will be good to build muscles and do their pec work after the surgery. So I have discussed about gynecomastia or enlarged male chest. If any of you boys and young men, if you have any such issues, kindly feel free. Don't hesitate, because this can change your life. Kindly contact your cosmetic surgeon at Apollo Spectra near you. Thank you so much.